Hello, I'm Dr. Frances Pitsillis. Here I'm going to speak to you about my approach to depression. Depression is something that 50% of us will experience at some stage in our lives. It's very common, and there are many fundamental things that can influence depression. So my approach is going to be from many different angles. If someone's deeply depressed when they see me and very anxious, I need to treat those fairly quickly, and so I will give medications to help anxiety and sleep and the depression. Medications can save lives. If someone's not as depressed, then we can take perhaps a more holistic approach, although we're still going to support the holism and all the biochemistry of the body anyway. So if someone's not as deeply depressed, and even if they are deeply depressed, I'm also going to have a look at all the fundamentals that I need to correct for that patient's mental health. After all, it is ultimately a biochemical and immunological imbalance that is causing their depression. So straight away, I'm going to want them to be able to sleep well. And if they're not on medications, I'm going to give them melatonin and magnesium at night. I'm also going to give them a general multivitamin and fish oil and vitamin C, because I know that they need all of those for the brain. All of the vitamins and minerals are required for the neurotransmitters in the brain. Actually, zinc and vitamin B6 have quite important roles in terms of balancing a neurotransmitter called glutamate and another one called GABA. You see, glutamate is more excitatory, which means you might get wound up and anxious, and GABA is more calming. So you see, vitamins do have a role, and fish oil has an anti-inflammatory role. Magnesium's role with the biochemistry in the brain is to help convert serotonin over to melatonin to help you sleep. And some antidepressants work by actually increasing magnesium in the brain. So that's interesting. I'm going to look at correcting diet, because we know that if the person doesn't have the right diet for their body, their biochemistry is not going to be as happy and it's going to be more inflammatory. So depending on what that person's been doing, I will help them make adjustments, although I will usually want them to avoid gluten, and in certain people I'll want them to avoid milk, yogurt and ice cream. It goes without saying that stress management is important, helping people to think about the way they think, because then they can view what's happening to them a little bit differently, so therefore the outcomes are going to be different emotionally for them. And if they really have to, they can go as far as having counselling. So on top of that, yoga, relaxation techniques, and anything that is going to help them to calm down and wind down. Some of the minerals and nutrients need to be tested. Low iron stores in the body influence anxiety, as does magnesium. So correcting low iron really can be helpful. Low zinc influences depression. Zinc acts as an antidepressant. The problem with the zinc test is that it's not quite so accurate, so I use a zinc taste test, which is a guide. Vitamin D is really important for mood. It's an antidepressant, it helps anxiety, it helps sleep, many things. That's something that people often don't test, but I think it's important to test vitamin D and correct it. Sometimes I will give patients what I call adaptive herbs. These can be very useful when the person is worn out, burnt out, clammy hands, dark circles. They've been overloaded for a long time and they need a little bit of lift. And these herbs can include rhodiola, withania, the other name for that is ashwagandha, Korean ginseng, licorice, Siberian ginseng, and an amino acid called tyrosine. I can often give that as well. And there's a particular supplement that has all of those in it that does very, very well to tone up that person. And then perhaps second last, I will look at hormones, depending on that person's age group, their situation. Are they an older woman that is lacking progesterone? Are they a middle-aged or older man that is depleted in testosterone? So that can be very, very helpful because testosterone in men is important for mood and anxiety and vitality and feeling good. In women, both estrogen and progesterone and other things are helpful in mood and anxiety and feeling better. And normally I would only last wish to give the antidepressants, but that's in a controlled situation where my patient is not very depressed and not very anxious. What is always very important to remember is that antidepressants save lives, and it's very important to get control of any serious depression and anxiety as soon as possible. So as you can see, it's quite a layered approach, and it's hierarchical, and there are priorities. But if we deal with everything and correct all the imbalances in all areas of the person's diet, biochemistry and immunology, we will help them overcome depression.